Hi, my name is Paisley Munene, and I am coming to you today to bring you a topic that is very dear to my heart, and it is bridging the mental health gap. Why we need more psychiatric nurse practitioners. Imagine waiting 3 months just to talk to someone about your anxiety. Imagine a loved one suffering from depression, only to be told that the nearest psychiatrist is 90 miles away. Can you imagine that? This isn't a dramatic exaggeration. It is reality for many Americans today. We are facing a national mental health crisis, and one key solution is often overlooked: psychiatric mental health nurse practitioner. That's right, a PMHNP. Today, I'm going to explain the growing mental health need in our country and how PMHNPs, which is the psychiatric nurse practitioner, how they are uniquely positioned to help and why we urgently need more of them in the workforce. So let's start with one, the growing demand for mental health services. The need for mental health care is rapidly increasing. According to the National Institute on Mental Health, so let me give you some facts. This was done in 2022. Nearly 1 in 5 U.S. adults live with a mental illness. That's over 50 million people. And the number is growing, especially after the COVID-19 pandemic, which triggered a widespread stress, isolation, and trauma crisis. Yet access to care is shockingly limited. The Health Resources and Services Administration, which is the HRSA, reports that over 160 million people in the U.S. live in a mental health professional shortage. That's nearly half of the population without sufficient access to psychiatric providers. And that's really scary. Number two, a shortage of psychiatrists and a solution. So part of the problem is that the number of psychiatrists is declining. What's happening is that there was a report from the Association of American Medical Colleges in 2022, so I'm giving you facts, that it projects a shortage of 14,000 psychiatrists by 2035. A shortage of 14,000 psychiatrists by 2035. So as more of the professionals retire, fewer are trained to replace them. So that gap is going to continue to widen. But here's where a PMHNP can come in. So psychiatric nurse practitioners are advanced practice registered nurses, also known as APRNS, who are especially trained to assess, diagnose, and treat mental health conditions. They can prescribe medication, offer therapy, and manage psychiatric care, often serving as primary mental health providers in clinics, hospitals, and private practices. PMHNPs have been proven to provide care that is just as equal in quality to that of psychiatrists, especially for common conditions like depression, anxiety, PTSD, and ADHD. Let's focus on number 3. PMHNPs improving access and equity. So PMHNPs are more likely to work in underserved areas, rural communities, correctional facilities, schools, and community clinics where psychiatrists are very scarce. According to a study in the Journal of the American Psychiatric Nurse Association, PMHNPs often fill critical gaps in care in low-income or remote areas, increasing access for populations that would otherwise go untreated. They also bring a holistic nursing-based approach to care, focusing not just on the diagnosis, but on the education, the family involvement, and whole person wellness, which is very important. Number 4, barriers to growth, and let's talk about how to fix them. So despite their value, PMHNPs face barriers. Let's talk about it. Many states have restrictive scope of practice laws. limiting what nurse practitioners can do without physician supervision. These restrictions can delay care and reduce efficiency, especially harmful in already short-staffed systems. However, evidence shows that states granting full practice authority to nurse practitioners see better outcomes and increased access. We must advocate for supportive policies and invest in PMH&P education and training programs to expand the workforce. This is needed. So, in conclusion, why do we need more psychiatric nurse practitioners? Because our mental health system is overwhelmed. Because millions of Americans are waiting, sometimes in crisis, for help that isn't there. And because PMHNPs are qualified. They are qualified, they are compassionate, just like a psychiatrist, and essential providers who can meet the need and the demand of the people. Increasing the number of psychiatric nurse practitioners isn't just smart policy, it's a moral imperative. If we want a healthier, more resilient society, we must invest in those who care for our minds just as we do for our bodies. Thank you.